Caldwell Luke operation. Caldwell Luke operation, which was described by George Caldwell in 1893 and Henry Luke in 1897, consists of two antrostomies. Canine fossa through sublabial approach, and inferior meatus intranasally. It allows for both dependent drainage and irrigation. It has a long history in the treatment of paranasal sinus diseases. This operation has held on its own for 100 years. Until the last quarter of the 20th century, this operation was the mainstay of treatment for chronic sinusitis. The postoperative factors, coupled with advances in CT scan and endoscopes, culminated in the development of FES. Though some infrequent indications still remain, FES has now replaced the Caldwell Luke operation as the treatment of choice in sinusitis. Indications. The main indication is chronic maxillary sinusitis. Other indications include complications of acute maxillary sinusitis, removal of foreign bodies or root of tooth, dental cyst, oroantral fistula, biopsy in suspected cases of neoplasm, recurrent antrochoanal polyp, fracture of maxilla or blowout fractures of the orbit, Horgan's transantral ethmoidectomy, pterygomaxillary space surgery such as ligation of maxillary artery through pterygopalatine fossa approach and Vidian neurectomy, in combination with endoscopic approach, orbital decompression and removal of inverting papillomas. Contraindication. It is contraindicated in children below 17 years of age. Anesthesia. General anesthesia with cuffed endotracheal intubation is preferred but can even be done under local anesthesia. Position. Patient is placed in supine position and face is turned slightly to the opposite side. Head end of the table is raised. Instruments. See the chapter on instruments. Techniques Figs 6A and B. Preparation. Local 1% or 2% lignocaine with epinephrine. 100,000 is infiltrated in gingivobuccal and gingivolabial. Sulcus. Nose is packed with cotton pledgets soaked in topical decongestant. Incision. Lip retractor retracts the upper lip. Cheek retractor can also be used for making a horizontal incision with its ends upward in the gingivolabial sulcus below the canine fossa. The incision cuts through mucous membrane and periosteum. In children, this incision is made above the level of secondary dentition, which can be seen in plain radiograph. Mucoperiosteal flap. Periosteum elevator is used for elevating the periosteum and soft tissues. The mucoperiosteal flap is raised superiorly up to the level infraorbital nerve, which should not be stretched and damaged. Canine fossa antrostomy. Using 4 mm osteotome and hammer or a drill, a window is made in the antrum through the canine fossa. Killian's nasal gouge, bayonet-shaped, can be used for opening the maxillary antrum. The window is enlarged as necessary using Carrison's punch or Satelli sphenoid punch. Removal of disease. The maxillary sinus pathology and diseased mucosa, cyst, benign tumor, and foreign body can be removed with elevators, curettes and forceps. Luke's forceps can be used to remove polyps, growth and bone pieces. Intranasal antrostomy. A curved hemostat is pushed into the antrum below the inferior turbinate at least 1 cm behind the anterior end of middle turbinate to avoid damage to nasolacrimal duct. This opening is widened to about 1.5 cm in diameter with Carrison's and side-biting forceps. Endoscopic examination. The maxillary sinus can be examined through both the antrostomies with the help of endoscopes. Packing. Ribbon gauze packing, which is impregnated with liquid paraffin or furacin 0.2% with W-nitrofurazone ointment, is prepared. One end of the packing is brought out from the nasoantral window into the nose and the rest is packed in maxillary antrum. Packing is also done in the nose. Dressing. Forceps Tillys, Wilds or Hartmann's can be used for packing. The packing takes care of bleeding. Closure. Sublabial incision is closed with absorbable suture. Postoperative care. Local ice packs. They prevent edema, hematoma and discomfort. Pack removal. Sinus and nose packing is usually removed in 24 to 48 hours. Antibiotic. Postoperative antibiotic is given for 1 week. Instruction to patient. Patient is instructed to avoid blowing of nose for 2 weeks because it can cause surgical emphysema. Complications. Bleeding is controlled with packing. Anesthesia of the cheek may last for few weeks or months and occurs due to stretching or injury to infraorbital nerve. Gentle sublabial retraction prevents this complication. Anesthesia of teeth, devitalized teeth. Facial asymmetry. Recurrent sinusitis and polyposis. Dacryocystitis due to injury to nasolacrimal duct. Sublabial oroantral fistula. Osteomyelitis of maxilla.